health insurance costs are climbing fast for employer-sponsored plans, Medicare, and those who buy coverage on their own through the Affordable Care Act plans.
The healthcare system is not prepared. 1 year in a nursing home could cost you $100,000, but 56% of adults said it would be impossible for them to afford that, according to a KFF survey.
Median annual cost for a private nursing home room was over $116,000. For in-home care, the median annual cost was $75,000.
Average retiree at age 65 is looking at $330,000 as a couple or $165,000 each in cost above and beyond what Medicare is going to cover for us.
There is a number that the retirement industry doesn't put on the brochure. It's not your mortgage. It's not your car payment. It's not even your grocery bill. It's $315,000. That's how much Fidelity Investments estimates the average 65-year-old couple will spend on healthcare in retirement.
A 65-year-old couple retiring this year can expect to spend an average of $315,000 in healthcare and medical expenses in their retirement.
And that number doesn't include long-term care, dental, hearing aids, or vision. When you add those in, the Employee Benefit Research Institute says the real figure could hit $428,000. Today, I'm breaking down where that money actually goes, why Medicare covers far less than you think, and the one number that should terrify every American planning for retirement. Let's get into it. Every year, Fidelity publishes what's become the most cited healthcare cost estimate in America. Their 2025 report puts the figure at $172,500 per individual, up from $80,000 back in 2002. That number has more than doubled in 23 years. For a couple, you're looking at roughly $315,000 to $345,000. And here's the part Fidelity themselves will tell you. That estimate only covers Medicare Part A, Part B, and Part D premiums, copays, and out-of-pocket costs. It explicitly excludes long-term care. It excludes dental. It excludes hearing aids. It excludes vision. Now, the Employee Benefit Research Institute ran a more aggressive model. At a 90% confidence level, meaning there's a 90% chance your costs won't exceed this amount, a couple could need up to $428,000. And if you need extensive prescription drugs, the number climbs higher still. But the most jaw-dropping projection comes from Health View Services, an actuarial firm that builds lifetime cost models. Their 2026 report found that a healthy 65-year-old couple in Missouri, not chronically ill, just healthy, could face $1,084,579 in total lifetime healthcare costs when you account for future inflation. If that couple falls into a higher Medicare income bracket, the figure climbs to $1.38 million. Let that sink in for a second. $1 million for healthcare alone for a healthy couple? Now, to be fair, most retirees won't actually write a check for $1 million. These are projected future value costs spread over a 20 to 30-year retirement, adjusted for inflation. The present value number is lower, but the trajectory is unmistakable. Healthcare costs are compounding faster than anything else in a retiree's budget, and most Americans haven't saved a fraction of what they'll need. And this is where the real crisis hides, because most Americans walk into retirement believing Medicare will take care of them. It won't. Not even close. Medicare Part B, your doctor visits, outpatient care, lab work, costs $202.90 a month in 2026. That's up $17.90 from last year, a 9.7% increase. Your Part A hospital deductible is now $1,736 per stay, and Part B charges you 20% coinsurance with no out-of-pocket maximum.
Medicare covers about 68 million Americans, and Part B premiums pay for the bulk of doctor's visits and outpatient care. The standard monthly Part B premium could go up by 11.6%.
Let me repeat that. Original Medicare has no cap on what you can owe. One Reddit user learned this the hard way. Their father had a hip fracture and paid $17,000 out of pocket on Original Medicare, without supplemental coverage. Another commenter in the same thread put it bluntly: there is no ceiling on Original Medicare costs without a supplement. And then there's what Medicare simply doesn't cover at all. Routine dental, $0. Hearing aids, $0. Routine vision, $0. KFF found that the average out-of-pocket cost for hearing care was $914. For dental, it was $874. And for the top 10% of hearing users, costs exceeded $3,600. 1 in 6 Medicare beneficiaries reported being unable to access dental, hearing, or vision care, and roughly 70 to 75% of those cited cost as the barrier. And then there's the elephant in the room, long-term care. A private room in a nursing home now costs a median of $129,575 per year. Assisted living runs $74,400 a year. Medicare pays essentially nothing for extended stays, and long-term care insurance premiums have skyrocketed. Many insurers raised rates 40 to 100%, while fewer companies even offer policies. Stay with me here because this next part is the structural reason why this crisis is getting worse, not better. HealthView Services, 2026 data report projects healthcare inflation at 5.8% per year. Social Security COLAs average 2.4%. That gap compounds ruthlessly. At those rates, a healthy 55-year-old couple today will eventually need 104% of their Social Security benefits just to cover medical premiums and out-of-pocket expenses. A 45-year-old couple, 129%. Translation, their entire Social Security check and every last dollar won't be enough to cover health care alone. Nothing left for rent, food, gas, or anything else. KFF's data confirms this is already happening. Medicare beneficiaries spent an average of $6,330 out of pocket on health care in 2022. That amounted to 39% of their Social Security income per person. 1 in 10 beneficiaries spent 39% or more of their total income on health care costs.
Turned out to be an infection that obsessed and went to the hospital and $9,000 out of pocket. So that's now $100 a month that I paid the hospital for that.
And the projection shows that share climbing toward 50% of Social Security income by 2030. And look, the Inflation Reduction Act did bring real relief for some beneficiaries. The $2,000 annual out-of-pocket cap on Part D prescription drugs is saving 3 to 4 million enrollees an average of $1,500 a year. That's meaningful. But the unintended consequence has been a 50% increase in Part D premiums since 2022, as insurers pass costs along to everyone else. One hand gives, the other takes. Meanwhile, on Reddit, a user whose wife is on a cancer drug called Ibrance, which retails at $19,000 a month, explained that without Medicare, their annual medical expenses could reach $250,000. Another retiree shared that their total monthly premium for Parts B, D, and Medigap had grown to $956, up from $686 just 2 years ago. The math is moving in one direction. So where does this leave you? The Federal Reserve's Survey of Consumer Finances found the median retirement account balance in America is $86,900. Fidelity says a single individual needs $172,500 just for basic Medicare costs. EBRI says a couple could need $428,000, and none of those numbers include a single night in a nursing home. The international comparison makes this even harder to ignore. The Commonwealth Fund found that nearly 25% of older Americans spent at least $2,000 out of pocket on health care, compared to less than 5% in France and the Netherlands.
You study the U.S. healthcare system, what immediately strikes you is how expensive it is compared to other countries. 1 out of every $6 that gets spent in the U.S. economy is on healthcare. It's about $2.7 trillion a year, which is larger than the GDP of France.
Americans skip medications at double the rate of seniors in other wealthy nations. Bottom line, if you're 5 years from retirement, pull up Fidelity's estimate and compare it to your actual savings. If the gap scares you, it should. If you're already on Medicare, look at your total annual spend, premiums, co-pays, deductibles, dental, prescriptions, everything, and calculate what percentage of your income it's consuming. And if you haven't looked at Medigap or Medicare Advantage plan options during open enrollment, that decision could be worth tens of thousands of dollars over the course of your retirement. Here's the truth. The average retired couple faces $315,000 to $428,000 in healthcare costs that Medicare alone will not cover. Healthcare inflation is running at nearly triple the rate of Social Security COLAs, and the median American has saved $86,900 for retirement, a fraction of what they'll need for medical expenses alone. If you're approaching retirement and haven't specifically planned for healthcare costs, this data is your wake-up call. The gap between what Medicare covers and what you'll actually owe is where retirements go to die. If you're already retired and watching your savings drain faster than expected, the 5.8% healthcare inflation rate versus your 2.8% COLA explains exactly why. If you're helping aging parents navigate Medicare enrollment, the plan they choose this year could save or cost them tens of thousands over the next decade. And if you're younger and wondering why you can't save for retirement, the system that's consuming 39% of your parents' Social Security income is the same system that will be waiting for you. I'll be covering Medicare enrollment traps, the insurance crisis hitting retirees hardest, and the states where your retirement dollar stretches furthest. Subscribe to Why with Harlan so you don't miss the next breakdown. Thanks for watching. That's the Why. I'm Harlan. See you in the next one.